A series of articles by the Albuquerque Journal's Shelby Perea helped to spur the legislature to change the law to allow students who have been prescribed medical cannabis to get their treatment on school grounds. Now, while that law passed last winter, the state just finished finalizing its rule, which requires school districts to adopt their own policies within state guidelines. And Julianne, while all this is being worked out, and it took a while, students are still getting pushback from districts. Could the state have done a little bit of a better job here? It just seems like the timeline with the few folks hung out to dry here.
I'm so glad you asked me that question. I mean, you've got the PED is responsible for taking this law from the legislature and promulgating some rules about it so that the districts have time to get ready for the upcoming school year. And so here we are in September, and the districts are still trying to make policies about, a law that was signed by the governor in April. I know that in terms of how long things typically take in the government, that's not a long amount of time. In terms of how quickly things happen in the industry I work in, that's a long time. And I think it can't help but wonder if the, governor's displeasure with the PED secretary had anything, to do. Was this one of the things that she wasn't moving fast enough about? That's pure speculation on my part, but when you have a big change at the top, it slows down a lot of things. So
yeah, I think you're quite right about that, actually. Your thought on that, Diane? Again, timing is tricky. The folks, as my read on it, the districts were starting to do a little bit of work, but they can only do so much before they get the final word. And we're not even going to have a final word here in Albuquerque until September 11th. Is when the next meeting is to finalize all this.
And school's been in session for 6 weeks. So you wonder,
Is it fair to the parents?
No, it isn't. And particularly because the way it reads is that the parent has to come and provide the treatment.
Let's talk about
that. It cannot be anyone at the school doing it. And so they're saying is that needs to be looked at so far as, but then every school doesn't have a school nurse either.
The state law says that they can designate someone. It doesn't say it can't be a school board staff. Is that correct?
I think so.
I mean, I think they could say that. They could say it's the school nurse that does this, or it's the,
But listen, it's not easy dealing with the school nurses. But have you been to one lately?
Yeah.
I think Julianne has it right, though. But it makes a point. I'm sorry, staying with you.
I was just going to say,
it makes a point. The nurses having a little cold feet about this.
They're having cold feet. They didn't increase their liability insurance. They're not covered for doing this. I mean, where does this go into the safety of the profession?
The other part of this, too, is storage. There's an issue about storage on campus that the schools and some of the school nurses are a little not so great about this idea.
School nurse offices are just got a simple little lock on the front door.
And
I mean, people can get in there and steal it.
That's right.
It's a real complicated process. But back to the timeline, that's silly. I mean, April to September, I believe they could have had more in place and more guidelines ready, because you're talking then on top of that, okay, maybe APS has done one thing, maybe Carlsbad School District's done another, and then suddenly the public education department comes out with the guideline that now they have to revise theirs. And here it is, the student or patient and the parent is having to fight with this the whole time and the whole way. So I just think they could have been a little more timely.
I'm hearing that loud and clear. Ed, you can't help but think about the parents. We'll go back to the parents for a quick sec. One of the fellows interviewed in one of the articles, I forget which one, said, look, I have a full-time job. I can't run down to the school 3 times a day to admit this to my child. There's got to be a halfway meeting of the minds here. Will we eventually get there? Is this just the first little bumpy start here? Do you feel like we can get there a little?
Well, we hope so. Unfortunately, and going back to our previous topic, this is just such a litigious society, right? Everyone is concerned. School personnel are concerned. The nurses are concerned. The school district is concerned about litigation. If they provide this medication to a child and there is some negative outcome as a result of that, they're very concerned about it. So I think the school's taking sort of the hands off, the least involvement possible, but it does have an impact on those parents who are trying to make ends meet or have these jobs that don't allow them the flexibility to go into school. And as one of the articles pointed out, this gentleman's child needed to be medicated multiple times during the course of the day. And that really puts the parent, the child, and even the peers in the classroom in kind of a tough position.
That's right.
Because there may be some acting out behavior. There may be a lot of interruptions to the school day to try to deal with that issue.
Yep, exactly right. Hey, the second part of this conversation for us is Santa Fe District Court Judge Brian Beachide. His decision that a rewrite to the state's medical marijuana law opens the program to out-of-state residents. Indeed, the judge said the rewritten law, quote, plainly and unambiguously does away with the requirement of residence, end quote. There's got to be some upshot here. What do you think? Are there positives? Are there negatives? Right, your gut reaction to that. It's an interesting ruling.
I think keep in mind we're talking about medical marijuana. We're not talking about recreational marijuana. So this will mean that patients who need medical marijuana can come across the Texas border, Texas-New Mexico border, let's say, and if they are qualified by the New Mexico Department of Health, they can purchase a medical marijuana. It immediately will mean more customers for the medical marijuana salespeople, and of course, one of the big advocates of this was one of the largest owners and growers of medical marijuana in the state.
One of the litigants, we should probably say.
Duke Rodriguez.
Well. Right, exactly right.
Actually, former Human Secretary,
That's
Human
right.
Services Secretary.
Now living in Arizona.
Yeah.
Now, you're right.
Yeah, but okay, so, and I think the governor is really resisting this. The governor is resisting this as a misinterpretation of the law. I'm not so sure whether this resistance is really warranted. I'm not sure what the harm is.
Right.
Well, the state's got itself into a pickle here. There's a problem with supply and demand.
Right.
There's
Yes.
already this false cap, on how much
much.
medicine each producer can produce. The patients have gone from 10,000 patients in 2014 to more than 70,000 patients
Yes.
now. The state has not increased the number of producers. They haven't allowed their producers to grow what they believe they need in order to provide the medicine their patients need. And so I can't help but wonder if the governor's stance about it is really more about protecting these previous decisions. We want a plant cap. We want to limit production. It makes me think about other medicine, though. Would we say, like, let's not produce any more, antacid because of some artificial constraint? Like, let's only, have enough of it, like what we think is enough. It just seems like a whole concept that needs some work in our state
There's
medical
an idea
program.
that the original plant count was just pulled out of thin air.
right.
It was.
It was a made-up number,
But-
and now we're wrestling with this. So.
Well, it was around 500. They raised it to 2,000, and now they've reduced it to 1,750. And that doesn't make sense to me. We just said how much the patient demand has grown. And then over here sitting on the sideline is recreational marijuana. And these are going to be the same producers producing this. And we discussed that at one time about how do we protect the medical marijuana program. Well, if we should go to recreational.
That's right. Ed, is there any law enforcement bounds here? I can't think of one myself, but any concerns about having out-of-state holders of medical cards here in New Mexico?
And no, I don't see any.
Okay.
As a matter of fact, I think it's probably a positive for law enforcement to be able to identify those individuals who are in this state and using cannabis.
Could be a problem when they go home, though, don't you think?
Yeah. When they cross that line back into Texas.
Sure. I mean, and there are some other issues, right? If we don't allow the card here and they have the cannabis here, they may run into some legal issues themselves. But if we're just trying to have access to medicine that they need, so I don't see a negative.
But wasn't there an issue about loading up your car with it and then taking it back across the border? I mean, you're getting it legally in Colorado. Right. This was in Colorado. You get it legally in Colorado, and then you're heading back into Nebraska with it. So,
Are you talking about recreational marijuana, or are you talking about medical marijuana?
And there are some.
I think I'm talking about both at this point, because it started out you had to qualify for medical marijuana, but they
still do.
Right, but you in Colorado is what I'm talking about. But you still could load your car up, could come and qualify and get whatever amount, and it was much higher amounts than what we have in New
But
Mexico.
it's always tricky crossing state lines. The jurisdictional questions about whether the cards apply, whether your California card is good and keeps you safe when you're in New Mexico, that's really the issue that this ruling doesn't even address that.
Yeah.
And that's more of, I think, what you're asking
And
about.
Gene, this is an easy fix, right? There's a legislative fix, and right, we just need to be patient. Take a look at the issues. We knew there were going to be issues that come up, right? As soon as this came out. So now we're dealing with some of those issues. Get it back before the legislature. I think the judge was correct in his decision. I think the statute was pretty straightforward. There may be some constitutional issues that arise if you try to prevent out-of-state people from obtaining a medical card here in New Mexico. So I think there are some broader issues. I think the judge made the right decision, but I think the legislature now has to come in and either clarify their decision or modify the statute so that there's clear understanding.
It boils down to whether that was the legislative intent or not.
That's a good
Did
point.
they intend
Intent,
to
that's right.
remove that
Excellent
requirement?
point there. That's why we love having state senators at this table. I love that.
Very good.
We're going to take a quick break. When we come back, we remember Justice Charlie Daniels.